We are in an aging society, and we're going to live even longer.
Joe VALYN. Joe VALYN had a hair transplant in his 20s.
This study on hair could be the basis for longevity.
Hair follicles are not joints, they're not tendons. It's very important to understand the quality of the PRP we need for hair. We are an aging society. As we age, we actually are going to get to live longer.
Dr. John Cole is a professional in his field. He is quite sharp in view of his professionalism and knowledge. He acutely raises issues that are really worth raising and sometimes often asks uncomfortable questions. In principle, I do the same thing, and my direct questions may not be to someone's liking either. What other method can we use to get at the truth that interests us? Just tactful curtsies between doctors sometimes do not make any progress, and it is worth being direct in order to find the truth. As far as I know, there have even been times when at a conference the organizers have been asked by Dr. Cole not to ask questions of those doing the presentations, because they didn't often have the answers to those questions.
And the cell is the most potent medicine in the world. It's more potent than anything we can do as physicians. As we age, our cells replicate, our telomeres get shorter.
Aging is the inability of a cell to replicate, but the hair cell is the one that can replicate itself over a lifetime. And studying the hair can be the basis of longevity. How's that news?
Based on epigenetics and our own genetic makeup, we have the potential to add 35 to 40 years. It's estimated that the first person that will live to 150 years of age will be born 10 years too soon to live to 1,000 years. Now, hair follicles tend to age much faster than faces. It's not uncommon to see men in their 20s who have the hair loss pattern of a 50 or 60-year-old man. So we have to consider regenerative medicine, because with surgery alone, we're not going to get there. Ryan mentioned we have to upregulate noggin, downregulate BMP, and then turn on the beta-catenin pathway. And that there is an interaction between adipocytes and follicles. Adipocytes proliferate during the anagen phase.
Do you need to maintain your hair with what treatments and techniques? Is one of the main questions that I will try to answer today, at least in part.
Hair follicles are not joints, they're not tendons, they're not skin, they're hair follicles.
When you go to a beauty therapist who does not deal with hair, do not confuse PRP with just one of the services that cosmetic salons can offer you, without really understanding what it is specifically designed for and what specific characteristics it has, especially for your particular case.
And so it's very important to understand the quality of the PRP we need for hair. And that means the concentration of the platelets, and whether or not it's leukocyte rich, leukocyte poor, whether or not it has red cells. And then we need a specific volume with a specific concentration. And we're going to need 8 to 10 cc's to treat a scalp. And very few kids on their own will do that. So where's the PRP? It's right above the red cell fraction.
Platelet-rich plasma, PRP, is prepared by centrifuging blood to separate its various components, including platelets and growth factors, from other blood cells. The resulting PRP is rich in platelets, which contain growth factors that may stimulate hair follicle health and growth. PRP injections are used in hair restoration procedures to potentially improve hair thickness and stimulate follicular activity. Platelet-poor plasma, PPP, is derived from blood by separating the plasma portion from red and white blood cells. It contains a low concentration of platelets and growth factors. PPP is often used as a control group in hair restoration studies to compare the effects of platelet-rich plasma, PRP. Red blood cells, RBC, they have limited relevance in hair restoration treatments, as they do not contain the growth factors that are important for hair growth stimulation. What if you have a transplant but do absolutely nothing in terms of hair restoration and treatment?
Meet the world's most famous bald man. Joe Biden. Joe Biden had a hair transplant in his 20s, and it was rather pluggy. Eventually, we taught his doctor how to make it look more natural, but he was bald. And if you look at him, he has very little hair in the back of his scalp. He was a poor candidate for hair restoration surgery, probably never should have had it done, but he did nothing to maintain his hair. And that is exactly what's going to happen to your patients if you don't institute regenerative therapy for your patients now. 30 years from now, they're going to have a problem. You cannot solve hair restoration surgery with transplants alone. These are regenerative therapy cases, no surgery. This patient came to me. I told him he's not a candidate for a hair transplant. So I put him on regenerative medicine. And he kept growing in. And at 9 months, I saw enough hair where I said, okay, we'll add some grass just to give you some color. And I kept following him. And 14 months later, he had improved color. And at 21 months, he had a full head of hair. That is a combination of surgery and regenerative therapy.
I will talk about this all accordingly as I digest all this information. Because until I will not be sure myself personally how it all works and how effective and interesting to us clients, and not those manufacturers or those who benefit from it and who make money on it. First I research everything in detail myself to understand how effective and useful it all is for us, and then I tell you. So doctors, clinics, manufacturers, please invite me and tell us more about it.
You gotta have all the tools in your basket. PRP is just one tool. It was first described in 1998 by Robert Maxwell, who's an oral maxillofacial surgeon in Miami. He noted that in his grafts to the mouth, that he needed a minimum concentration of platelets of 1 million. How many of your PRP kits hit 1 million platelets? You know, it's only been in hair restoration surgery since 2005. As the concentration of platelets increases, the concentrations of growth factors increases in a linear fashion. And that 70% of those growth factors are released in the first 10 minutes after following activation, and almost all of them after 90 minutes. From my studies, I know that if I can hit a desired concentration of platelets, which is going to be at least 600 to 800,000, I will have a 50% increase in hair density. If I use another product like Regen, which cannot hit those targets, you're not going to see an increase. You're actually going to see a decrease in hair density. Based on all the systems I've looked at in Europe, there's only one that interests me, and it doesn't interest me much.
Are all PRPs the same? On the one hand, there may even be a not very expensive PRP that you go to every week at a particular medical center or cosmetologist. Or that PRP that costs a ton of money but you have to have it done much less often? Is there a difference?
I've done my own research comparing different kits, and Insight and Magellan are the two kits I like. Insight is going to give me the platelet increase I want. It's going to give me a capture rate of 71%. Angel Arthrex has a capture rate of only 35%. That's pathetic. Regen can't hit the target. That's useful in orthopedic surgery, but not in hair restoration. So, capture rate, what the heck is it? Well, if we have 100 platelets in the whole blood, and we capture 70, we've got a 70% capture rate. So where did the other 30% go? Here's one of my examples. I had a baseline of 269,000 platelets. I concentrated it to 1.5 million platelets, and then I sonicated it, or burst the platelets, and ended up with around 6,000 platelets. The rest of it turned into pure growth factors and cytokines. But interestingly enough, this is the same patient, same blood draw, same kit, two different kits out of the same package. One had a capture rate of 57% and the other a capture rate of 73%. There is a very significant lack of standardization in manufacturing of these kits.
Does the PRP work 100% or not? Is PRP a waste of money and time, or is it 100% investment? No one can tell you for sure. Just as no one can promise 100% results from any hair transplant. I was impressed. What am I studying now? And is what the world's doctors are doing the most. This is stem cells. This is exosomes. This is effective PRP and laser technologies. There is research, and I always listen to what the really world doctors are saying, based on the numbers. Something that even non-doctors can track and analyze.
So where's the PRP? It's right above the red cell fraction. And right on top of that red cell fraction is the buffy coat. And what I'm going to do now is go through every single CC of that entire mixture and look for where that 30% of the platelets went. And this is my study I set up. I'm just going to rush through it. That yellow is a combination of PPP and PRP. The very bottom, after following centrifugation, is going to be my PRP. And with the insight, that's less than 7 cc's. Remember, I need a minimum of 8 to 10, so I have to use 2 kits on every patient. It's expensive. And we're going through it. So looking at the PPP, the platelet-poor plasma, most of those platelets are in the top 2 cc's. But there are platelets in every single cc of platelet-poor plasma. We don't get them all in PRP. If we look at the buffy coat, it has about 2% of the platelets. But these are really good platelets. They're big and they're loaded with growth factors. We add another 2 cc's with that. But looking at every fraction, there's 4% of the platelets in the PPP, 70% in the buffy coat and PRP. There's 8, almost 9% in the red cells. I look at every single cc of the red cell, the platelets from top to bottom. In total, 83.18%. So where's the other 17%? I don't know. I have no idea. Maybe they clumped, maybe they got stuck to the wall. So I like to make cytokine-rich plasma, which means that I burst the platelets, I use a sonication system, I'm trying to extract all the juice out of that lemon. I don't need this clot. That clot only functions to trap high molecular weight proteins. So the high molecular weight proteins can't get out. I want pure lemon juice.
What else besides PRP can be used? There are actually various studies that can be applied to hair, and a lot of it is already being tested. But again, until I research on my own and understand how it works and shows direct efficacy. This is how it should be applied, and this is the effect you can get. Before that, of course, I will not present anything to you until I am sure myself. Just like what happened with finasteride itself. When for 2 years I followed the trials, the results, and the fact that the doctors themselves were using it. And only when I realized that okay, I can tell you about it and show you the real results. Then you can make your own decision based on that, whether to take finasteride or not.
So I designed this system, and it is a sonicator. I sonicate it 30 minutes with 30 seconds on, 30 seconds off to burst the platelets. Meanwhile, I keep the PRP at 4 degrees Celsius to minimize protein denaturization. The device I use is called the BioReptor Plus. I apply cavitation to the cells, and we burst them. What I found was that 15 minutes of sonication is not enough. I need to go to 30. But at 15, I'm getting equal to calcium gluconate activation and bovine thrombin activation. Once I go to 30 minutes, you can see there's a difference between the kit and the sonication time. At 30 minutes, I got 5 times the concentration of high molecular weight proteins like PDGF. This is a 24.3 kilodalton protein. Regen, as you can see, underperformed. VEGF, high molecular weight growth factors, 5 times the concentration with sonication versus standard calcium gluconate activation. Good PRP from Angel Arthrex, outperformed Regen in every case. TGF beta 1, high molecular weight protein, 5 times the concentration of sonicated PRP. IGF, very important growth factor, structurally homologous to insulin, and you'll see that it's in a similar concentration regardless of how it's produced because it is a low molecular weight 7 kilodalton growth factor. So there factors that control the growth factor concentration, and this is going to control your results. You're not going to get results like this with something like Regen, which cannot produce the concentration of platelets we need. Now, what can we see from higher growth factor concentrations? I did a side-by-side study. I put calcium gluconate activated on one side, sonicated PRP on the other side. This is a half-head study. Sonicated PRP, higher growth factor concentrations came in sooner. So then I designed a study. I put 8 follicular units per 4 square centimeters in 3 boxes. One box got saline, one box got calcium gluconate activated PRP, and one got sonicated PRP. And then I moved the boxes around because I also grafted the front and put sonicated PRP there, and I think gravity polluted some of the results of the study. I made sure to count every single follicular group. The results were, at 4.5 months, I had 99% of the grafts in the growing phase in sonicated PRP, 75% from calcium gluconate, 72% from saline. So there definitely is an improvement with higher concentrations of growth factors. So, if you look at commercial kits, we did this study in Istanbul, Turkey, a while back, and we found that one of the kits one of the doctors brought in was not PRP. It was platelet poroplasm. Baseline platelet count, 238,000. Platelet count in his PRP, 37,000.
I've been thinking and realized that I can't help absolutely everyone. There is a certain resource of my own that I can't spend on the whole world. And it's actually not realistic. I'm honestly not a doctor. I'm a person who has suffered a lifetime of baldness. And it's very important to me at least to try to help those who couldn't help me in my 20s. Nobody helped me then, only made money on me, and I lost all my hair and valuable time. And here are those who understand what I do, how I do it, and why I do it. First of all, my blog is for you, so that we achieve results. The first year I was worried about here's someone going on their own way to really bad clinics, which I call fast food clinics. Now I realize that I cannot affect the decision of someone who even wants to simply go to the guillotine. It's important for me to focus my attention on the journey I see in front of me and help those who can trust and walk beside me. This is who my blog and my research is for.
And just kind of rush through this just to kind of show you, I don't have time to go into all the detail, but we designed a study looking at different means of treating dermal papilla. We cultured dermal papilla, 20,000 dermal papilla. We plated a 24 plate well. First part of the study, we looked at concentration. We found that growth factor concentration was highly dependent on the regrowth. FGF7 was also concentration dependent. The higher the concentration, the better the regrowth. Individual growth factors did nothing. Then we added adipose, and we also looked at platelet lysate that equal to the base media, and FGF7 production is higher. It's concentration dependent as well. You got to start this therapy early. You cannot wait. And then using ultrasound, you can see that this hypoechoic structure is the hair follicle. It doesn't grow straight up and down in the skin. It grows at an angle. And therefore, based on the average follicle length of 4.9 millimeters, we can see that this follicle lies in 3.34 millimeters of depth. So in other words, where do you have to put your injection? Do not go 4 millimeters. You're going to be under all the follicles. If that follicle is at 3 millimeters, it's going to reside around 2.45. So we want to be right in, since the ultrasound guided injection, then both of these are like 1/8 to 3/8. You want to be in that zone. Okay? Thank you.
What do we do with you at a free consultation or individual one-on-one calls? I find out as much information about you as possible, so that I can start from something. The more information I have, the more I can draw a line, predict something that may happen to your hair, and based on this problem, figure out a solution and understand which way to go. Which of the doctors and clinics will help you better at one stage or another? Maybe some treatments and cures can help without a hair transplant. It's the same with PRP. For some, this may work, but for some it may not cause any visible effect or result that you expect. After all, many moments are related to your personal health and condition.